Bruno, and for today I'm going to demonstrate to you on how to assess or how to get the fundal height measurement of a patient. So first, what is fundal height? Fundal height is used to determine the gestation and growth of a fetus. Also, it is used to identify multiple pregnancy and complications of pregnancy. Okay, so first, you should provide for the client's privacy, and you should also provide a warm environment for the patient, such as closing the doors and closing the curtains. The rationale so that the patient will be comfortable during the whole procedure. After that, we need to check the patient information, record, or ID. And of course, wash hands or perform hand hygiene and observe other appropriate infection control procedure, and wear gloves if it is necessary. The rationale is to reduce the microorganism onto your hands. Then you need to introduce yourself to the client and also explain to the client what you are going to do, then why it is necessary. Then you need to get her fundal height. So, ma'am, ako po si Kyla Bruno. Ako po ay isang student nurse. Kukunin po natin ang measurement ng inyong fundal height. Dito po natin malalaman kung ilang weeks or months na po si baby. Okay lang po? So, now for the procedure, first you should obtain for the maternal consent of the patient. So, ma'am, meron po tayong consent na kailangan yung pirmahan. Okay lang po ba sa inyo yun, ma'am? So, po yung consent niyo po, pirma na lang po kayo dito. The rationale is to gain her cooperation. Then start inspecting and palpating the abdomen of the patient. So, the rationale to assess the shape, size, presence of linea nigra, stria gravitarum, and also if there are any palpable mass. Then, encourage the woman to empty her bladder. So, ma'am, kailangan niyo po mag-urinate para po mas makuha po natin yung accurate measurement ng inyong baby. The rationale is that the fundal height can be 3 cm higher at 17 to 20 weeks gestation if the woman has a full bladder. Then position the client into dorsal recumbent with her legs extended. So let's imagine that the patient is in dorsal recumbent position. The rationale, a supine position has been found to yield least variation in measurement, and also kapag naka-supine position kasi yung patient, pwede siya mag-cause ng supine hypotension, which is nagkakaroon ng compression sa inferior vena cava ng pasyente. Consider placing a wedge under the right buttocks if the gravid uterus is a size likely to compromise maternal or fetal circulation. The rationale, an enlarged uterus can compress the inferior vena cava and the lower aorta, leading to maternal supine hypotension. Also, ensure that your hands are clean and warm. Warm hands will minimize maternal discomfort and potential for inducing contraction of the uterus. Now we are ready to place the zero mark of the tape measure at the uppermost border of the uterine fundus. Okay. Now run the tape measure along the midline of the woman's abdomen to the uppermost border of the symphysis pubis. The rationale is to locate the fundus. Also, document the distance in centimeters and compare it with calculated gestation. So, the measurement is 24 centimeter and it is 2 centimeter above the umbilicus, meaning the fetus is around 24 weeks. going to demonstrate Leopolds maneuver. But first, what is Leopolds maneuver? Leopolds maneuver are common and systematic way to determine the position, lie, and presentation of the fetus inside the woman's uterus. Now we are going to proceed on performing hand hygiene again. The rationale is to reduce the microorganism onto your hands. Then, explain to the client the whole procedure. Now, ma'am, magpe-perform naman po ako ng Leopolds maneuver para po ma-determine natin kung ano pong position ni baby. Okay lang po ba sa inyo yun? Okay, so position the client on dorsal recumbent position. So, let's imagine na naka-dorsal recumbent position yung pasyente. And rub also your hands and warm the palms. Okay. Now, we are going to proceed on performing the Leopolds maneuver. For the first maneuver, stand on either side of the bed and face the upper part of the mother, and you should palpate the superior surface or the fundus of the abdomen. By doing this, it identifies what fetal pole occupies the fundus. Okay, for the Leopolds maneuver 1, we report this as either LM1 cephalic or LM1 breech. The fetal head is firm, hard, round, and movable, whereas the buttocks will feel softer and bulkier. For the second maneuver, palpate the side of the abdomen with palms of both hands, and here we will determine on which side is the fetal back or the small parts. So I can feel here firm, hard, long, and then here I can feel the lungs, knobs, and irregular flakes. Okay, for the Leopolds maneuver 2, as we palpate, we will determine if the fetal back is in the left side or right side. So, the fetal back is in the left side. For the Leopolds maneuver 3, with the same position, use your thumb and fingers of one hand and grasp the lower portion of the maternal abdomen just above the symphysis pubis. Determines if the engagement of the fetal presenting part has occurred. If not engaged, a movable body part will be felt just above the symphysis pubis. Again, the fetal head will be felt as firm, hard, round, palatable, and movable mass, whereas the fetal breech will be feel softer and bulky. So for Leopolds maneuver 3, we will report this as LM3 cephalic or LM3 breech, and if the fetal presenting part is unengaged or engaged. For the Leopolds maneuver 4, reverse the position and face the lower part of the mother, and then place one hand each on either sides of the lower pole of the uterus just above the symphysis pubis. This will determines on each side of the cephalic prominence and correctly identifies the fetal attitude of the fetus. Okay, if the hand presents one hand is arrested sooner than the other by a rounded body, that's called the cephalic prominence, while the other hand descends deep into the pelvis, and if the cephalic prominence is in the same side as the fetal small parts, then the fetal head is in a flexed position. If the cephalic prominence is in the same side as the fetal back, then the head is an extended position. So let's imagine that the baby is in flexed position, and that's normal. Next, auscultate the fetal heart tone. And once you determine where the fetal back is, start counting the fetal heart tone using the stethoscope. Lastly, explain to the client regarding on the data that you've gathered. So, ma'am, bale, Regarding po sa data na nakuha ko, ang ulo po ni baby ay nasa ilalim po ng inyong tiyan. At yung fetal back niya po is nasa left side. And yung buttocks niya po is nasa may fundus or sa may pinakatuktok po ng inyong tiyan. Wala po kayong dapat ikabahala dahil normal lang po ito sa mga pasyenteng katulad nyo na nagbubuntis. That's the whole procedure on how to demonstrate fundal height and Leopolds maneuver.